General massage for the abdominals. Before you start work on the abdominal area, use your palpation and assessment skills to see what is happening. You can start by looking at how your client is breathing, how their ribs move, and how their belly moves within that breath. You start with some lotion, placing your hands onto the tummy. Now when you start, always work really slowly to begin with, just so your client starts to get used to your touch. And you can start with circular motions going in a clockwise direction to begin with. So here I'm just using my supported fingers moving around the diaphragm border down towards the bottom of the ribs. You can go in an anti-clockwise direction as well. So here I'm coming across the lower part of the tummy. Again, working really slowly, as this is quite a sensitive area for lots of clients. So it's making sure they feel comfortable to your touch. From here, you can work along the line of the linear elbow, thinking about the rectus abdominis, either side of that, and drawing down towards the umbilicus. Again, I'm pushing off my back leg and just leaning back into that back leg as I draw the hands down. You can work in a slightly angular motion, so working from the ribs towards the belly button, and then working your way around from the side of the torso in towards the umbilicus. And you can do that all the way around. And you work between these strokes depending on what you find. You'll often find some tightness or tension around that diaphragm border. And you can slow down your strokes here and use a different applicator. So you might want to use a supported thumb with a relaxed hand. And again, working really slowly along that diaphragm border. You can use the same assisted fingers again along this line. And if we think about the breath, we want to incorporate work around the ribs and the intercostals in here. So I'm just doing some work with my fingers in between the ribs along the line of the intercostals, supporting with the other hand, and just drawing the arm back. So it's an effleurage technique. I'm leaning into my back leg, leaning back with my body, and effleurage along the intercostal area. And here you can use your assisted fingers to slow down that stroke and deepen that stroke along the diaphragm border. And we can use our supported fingers to work across the torso from the lateral towards the midline, slowing down that stroke, working across the fibers. And from here, we can work along the top of the iliac crest. So thinking about those glute attachments around the top of the pelvis, we can incorporate this into our abdominal work. So I'm using my supported hand, supported fingers, leaning back and working along that iliac crest. You can take quite a grip of the client's pelvis for that position and really lift up as you slide across the tissue. And we can advance our techniques with some sliding soft tissue release. Now, you'll cover soft tissue release later in the course, but it's good to integrate it here straight away with a little bit of moving soft tissue release. You ask your client to let the ribs relax into the couch, and then as you slide along that linear elbow, you just ask them to lift the ribs up, which creates that greater stretch in that area. And you can move your hand to a slightly wider position, working from that diaphragm border towards the umbilicus.